My name is Llewelyn. I am Professor of Infectious Diseases here at Brighton Sussex Medical School, and I am a consultant physician in infectious diseases at Brighton Sussex University Hospitals Trust. So antibiotic resistance is a major and growing issue in modern medicine. It basically means that the treatments that we commonly use to treat common infections are increasingly ineffective. Antibiotic resistance arises for many reasons, but in part because of antibiotic overuse, so giving patients antibiotics either when they don't need them or for longer than they need them. So in July of this year, we published an analysis piece in the British Medical Journal called "The Antibiotic Course Has Had Its Day." And this piece challenges one of the longest and most deeply held beliefs there is really in how antibiotics should be used to prevent antibiotic resistance. Namely, the idea that if your doctor prescribes a course of antibiotics, unless you complete that course of antibiotics, you put yourself and indeed other people at risk of antibiotic resistance. The key thing to say is that the analysis does not disagree with current guidance from Public Health England in the UK and indeed CDC in North America, which is that patients should take their antibiotics as advised by their doctor. There's all sorts of good common sense reasons why that's important. Dosing, dose intervals, these are really important factors in determining how well a patient will respond to antibiotic treatment. But we want to add into that discussion that patients have with their doctors or prescribers the idea that not only do I need antibiotics or not, but when will I know that my antibiotics should stop? For doctors, we would like doctors to start considering patients more than they do in this area of infection really as individuals rather than examples of a syndrome. So rather than thinking this patient has pneumonia, they need a certain duration of treatment, to approach the question from the point of view of when does this individual patient know that they've had enough antibiotic treatment. But we've given very little thought to decision making around when to stop antibiotic treatment. And I think we're starting to realise that that's a very important question if we are to reduce antibiotic overuse.